That weight in your legs. It's not just tiredness, is it? It's a deep, heavy feeling, like you're wearing lead boots, and every step is a monumental effort. Then there's the climb up a simple flight of stairs. It feels like scaling a mountain. Your chest tightens, the air won't come, and you have to stop, gasping, leaning against the railing while your heart hammers against your ribs. You feel a profound sense of betrayal by your own body. This is not just a feeling. It is a physical reality you are living with every single day. And perhaps the most visible sign is the one you see at night. When you finally take off your socks, there's that deep, angry groove etched into your swollen skin. A painful reminder that something is wrong. You might even feel a sudden wave of dizziness when you stand up too quickly, the world tilting for a frightening second. Please, hear me now. This is not just getting older. And it is absolutely not your fault. You have not done anything to deserve this constant state of exhaustion and discomfort. My entire professional life has been dedicated to understanding the heart, specifically in people over 60. As a physician, I've dedicated the last few decades to helping my patients thrive, not just survive. I've seen firsthand how these vague symptoms are dismissed, ignored, and misunderstood, often until it's too late. But today, that cycle of uncertainty ends for you. We are going to connect these dots and uncover what your body has been desperately trying to tell you. Most of these signs are subtle, but one of them is a fire alarm your body triggers almost exclusively at night while you sleep. And understanding what it means can literally be the difference between waking up tomorrow or not. I'm going to reveal what that sign is and why it's the clearest evidence your heart is screaming for help. Before we continue, I need you to make a commitment, not to me, but to yourself. Subscribe to this channel right now so you do not miss this life-saving information. Press that like button if you are ready for relief. And comment below, which symptom worries you the most? The swelling? The breathlessness? Let me know. Your journey to clarity begins now. Before we can fix a problem, you must understand exactly what is broken. And what's happening inside your body is not a mystery or a vague sense of getting older. It is a specific, mechanical failure. All the symptoms we've talked about, the leaden fatigue, the breathlessness, the swelling, they all point back to one single root cause. It's not your fault, and it's not inevitable. It's a problem of physics, of pressure, and of flow. I want you to picture your heart not as a complex organ, but as something much simpler, the central water pump for a two-story house. Your house. This pump is a marvel, designed to work tirelessly for a century. But like any powerful machine, it depends on its own fuel lines. Tiny, critical pipes that deliver oxygen and nutrients to the heart muscle itself. These are your coronary arteries. Over the decades, those pristine fuel lines can start to get clogged. Imagine rust and sludge building up on the inside of a water pipe. In your arteries, this sludge is a hard, waxy substance called atheroma plaque. As these plaques grow, they narrow the pipes, choking off the vital fuel supply to the heart muscle. Your pump, the very engine of your body, begins to starve. This starvation of the heart muscle has a clinical name: myocardial ischemia. It is the silent, ongoing suffering of your heart cells being deprived of oxygen. This isn't a feeling, it's a physical crisis happening at a cellular level. The pump's motor is sputtering, trying to do its massive job while running on fumes. This is the origin point of every single symptom you are now forced to live with. So what happens to the house when its central pump loses power? First, it no longer has the strength to send water with enough pressure to the second floor. The upstairs rooms, which represent your brain and your muscles, don't get enough water, or in your body's case, oxygen. This is the direct cause of your fatigue and dizziness. Your body is in a state of low cardiac output, meaning the total volume of blood being pumped is simply not enough to meet your body's demands. But a weak pump creates a second, equally devastating problem. Not only can it not push blood forward effectively, but it also can't pull blood back from the drainage system, the veins in your legs and feet. The blood begins to back up, creating a traffic jam. This is called MILR, increased capillary venous pressure. The pressure inside those vessels becomes so great that plasma fluid is literally forced out and leaks into your tissues, causing a flood in the basement. That flood is the swelling, the peripheral edema, that leaves that deep, painful line from your socks. Do you see it now? It's not a mystery. It's a plumbing problem. A powerful pump is being starved of fuel and is losing its ability to maintain pressure. The good news is that plumbing problems have solutions. Now that you understand the why, we can finally address the specific fire alarms your body is sending. We will go through the 6 main signs, one by one, starting with the one that often appears first, but is almost always dismissed as something else. Let's begin with the very first whisper from your struggling heart. We'll count them down, from the most commonly dismissed to the most urgent. The first sign is something you've likely been blaming on your age or fitness level for months, even years. It's called dyspnea on exertion, a clinical term for a feeling you know all too well, a progressive, creeping shortness of breath. It starts subtly. First, you get winded walking up a steep hill. Then, it's a single flight of stairs. Soon, you find yourself pausing for breath, just walking from the car to the front door. This isn't a lung problem, it's a delivery problem. Because your heart's output is low, your body is screaming for more oxygen, but the transport system, your blood flow, can't keep up with the demand. Your lungs are working overtime, trying to pull in more air to compensate for the heart's inefficiency. Here is your first action. Stop guessing. Start quantifying. Get a small notebook and write down exactly what triggers your breathlessness. I got winded after 12 stair steps. Or I had to stop after walking 100 yards on a flat surface. This specific data transforms you from a worried patient into a prepared advocate for your own health. The second sign is that profound, inescapable fatigue. This isn't the normal tiredness you feel after a long day. This is a deep, cellular exhaustion that settles into your bones and doesn't leave, even after 8 hours of sleep. You wake up feeling like you never went to bed at all, as if your internal battery never charges above 20%. You feel heavy, slow, and perpetually drained, forcing you to ration your precious energy just to get through the essential tasks of the day. The mechanism here is direct and relentless. With reduced blood flow from that weakened pump, your muscles, your brain, and all your vital organs are not receiving the ideal amount of oxygen and nutrients. To survive, your entire body shifts into a permanent low-power mode. This is not laziness, it is a physiological state of emergency. I want you to ask yourself this question tomorrow morning, the moment you wake up. After a full night's rest, do I feel restored, or do I feel just as exhausted as when I went to bed? If the answer is exhausted, that is a significant red flag. Sign number 3 is the one you can see and touch. It's the swelling, or edema, in your feet, ankles, and legs. It's the reason the shoes that fit perfectly in the morning feel like a vice by the afternoon. It's the cause of that deep, angry groove your socks leave etched into your skin. This happens because the right side of your heart, which is responsible for pulling blood back from your body, is failing. It creates a traffic jam in your veins. The pressure builds and builds until fluid is literally forced out of your blood vessels and into the surrounding tissues, pooling in your lower body due to gravity. I want you to perform a simple, powerful test right now, if you can. It's called the pitting test. Press your thumb firmly into the swollen part of your shin for 5 full seconds. Now release. Look closely. If the indentation from your thumb remains for several seconds, like a pit in soft dough, that is a classic sign of pitting edema. This isn't just water retention. It is physical evidence of your heart's struggle, and it is something you must show your doctor. The fourth sign is that sudden, frightening sensation that the world is tilting. It's the dizziness or lightheadedness that hits you when you stand up from a chair or get out of bed a bit too quickly. For a terrifying second, the room may darken, and you have to grab onto something to keep from falling. This is often dismissed as a head rush, but it has a specific cardiac cause. Orthostatic hypotension. Your weakened heart simply cannot adjust your blood pressure fast enough to compensate for the change in posture. When you stand up, gravity pulls blood down to your legs, and for a moment, there isn't enough pressure to get sufficient blood to your brain. It's a momentary blackout. To protect yourself, starting today, I want you to adopt a new habit. When you get up, pause. Sit on the edge of the bed for 30 seconds. Let your body adjust. Then, and only then, stand up slowly. If these dizzy spells are happening frequently, it is a major warning sign. Now we arrive at sign number 5, and this is where many people get dangerously misled. We all have this image of a Hollywood heart attack, a person clutching their chest in agony. But for many, especially women, the pain is completely different. It's an atypical pain that shows up in your jaw, your neck, your back between the shoulder blades, or even your stomach. It can feel like a dull toothache, a muscle strain, or a burning indigestion that just won't quit. This happens because of a phenomenon called referred pain. The nerves from your heart share the same pathways in your spinal cord as nerves from these other areas. Your brain gets its wires crossed. It can't tell where the distress signal is truly coming from. So please, hear me now. Any new, unexplained pain in these regions, especially if it gets worse with activity or is accompanied by a cold sweat, should never be dismissed. Do not assume it's just a pulled muscle or something you ate. And this brings us to the most dangerous myth of all, a mistake that can have fatal consequences. You feel that burning sensation in your stomach, a discomfort that feels exactly like severe heartburn. Your first instinct, naturally, is to reach for an antacid. You think, it's just bad acid reflux. Please stop. What you may be experiencing is ischemia of the inferior wall of your heart. The bottom part of the heart muscle is being starved of oxygen. This part of your heart rests near your diaphragm and stomach, and it's connected by a large nerve called the vagus nerve, which also connects to your digestive system. This nerve gets confused, sending a signal to your brain that mimics indigestion perfectly. Treating an impending heart attack with an antacid and going back to sleep can be a final, tragic mistake. If you have heartburn that doesn't get better, worsens with exertion, or comes with sweating and paleness, it is a cardiac emergency until a doctor proves otherwise. Finally, we have arrived at the sign I promised you at the beginning. The fire alarm your body triggers almost exclusively at night. Sign number 6. This is the clearest and most urgent evidence that your heart is crying out for help. It comes in 2 forms. The first is orthopnea, the undeniable need to sleep propped up on 2, 3, or even 4 pillows just to be able to breathe comfortably. Lying flat becomes impossible. The second, and even more terrifying, is paroxysmal nocturnal dyspnea, or PND. This is when you wake up suddenly, an hour or 2 after falling asleep, gasping for air. You feel an overwhelming sense of panic and suffocation, forcing you to sit bolt upright or even run to an open window, desperate to catch your breath. This is not a nightmare. It is a physiological crisis. When you lie flat, all that fluid that has been pooling in your legs all day gets reabsorbed back into your bloodstream. A healthy heart would simply pump the extra volume, but your failing heart cannot. It becomes overwhelmed, and the fluid backs up into your lungs, causing pulmonary congestion. You are, quite literally, slowly drowning in your own fluids. Sitting up uses gravity to pull that fluid down to the base of your lungs, freeing up space for you to breathe. Let me be absolutely clear. This is not a symptom to watch. It is a medical emergency. If this is happening to you, you need an immediate medical consultation. Your life depends on it. You now have the knowledge. You understand the why behind the fatigue, the swelling, and the stolen breath. But knowledge without action is just a story. What you need now is a plan, a simple daily set of actions that transforms you from a worried observer into the vigilant guardian of your own heart. This isn't a complex medical regimen. It's a daily conversation with your body, a way to collect the exact evidence you need to get the help you deserve. Let's build your new routine, starting from the moment you wake up. Your day will now begin with intention. In the morning, before your feet even touch the floor, I want you to perform a sleep check-in. Ask yourself 2 critical questions. How many pillows did I need to breathe comfortably last night? And did I wake up suddenly gasping for air at any point? Write down the answers. Next, you will practice the 3-step rise. First, sit on the edge of the bed for 30 seconds. Then, place your feet flat on the floor for another 30 seconds. Only then, stand up slowly. Note any feeling of dizziness or lightheadedness. This simple habit protects your brain. Finally, if you have a home blood pressure cuff, this is the perfect time to take a reading and log it. As your day comes to a close, you have 2 more crucial check-ins. In the afternoon or evening, it's time for the sock test. When you remove your socks, look closely at the indentation line left on your skin. How deep is it? How long does it take to disappear? Use your phone to take a quick picture. This creates a visual diary of your fluid retention that is more powerful than words. After that, perform a walk and track. During a light walk, perhaps to the mailbox, count exactly how many steps or yards you can go before you feel that familiar shortness of breath. This isn't about pushing yourself. It's about establishing a clear, objective baseline. Finally, your night routine is about setting your body up for a safe and restful sleep. 1 hour before bed, I want you to practice preventive elevation. Lie down comfortably on a sofa or your bed and prop your legs up on pillows so they are slightly above the level of your heart. Do this for just 15 to 20 minutes. This simple act uses gravity to help your veins return fluid to your core, reducing the workload on your heart overnight. Then, make a conscious choice for your last meal of the day to be a Phi low-sodium dinner. Drastically cutting back on salt in the evening is one of the most effective ways to prevent your body from holding on to excess fluid while you sleep. Do you see the power in this? These aren't just tips. This is a system, a way for you to gather undeniable proof of what your body is experiencing. You are no longer dealing with vague feelings, but with concrete data. The number of pillows, the depth of the sock line, the exact number of steps you can take. This information is your power. It is the language your doctor understands. It is the key that unlocks the door to a correct diagnosis and effective treatment. This journey is not about living in fear. It is about replacing that fear with clarity and control. The signs we've discussed are not a life sentence. They are a wake-up call, an urgent invitation from your body to listen and to act. Your heart has been whispering. And now you know how to hear it. The feeling of lightness in your legs, the simple joy of climbing stairs without gasping for air, the confidence of standing up without the world spinning. These are not distant memories. They are possibilities, waiting for you to claim them. Your new life begins with the very next action you take. Start this simple monitoring routine tonight. Commit to it. If this information has empowered you, please subscribe to this channel so you do not miss the vital health updates that could protect you and your loved ones. And your journey doesn't end here. Understanding the signs is the first step. The next is taking action to address the root cause. In our very next video, I will reveal the 3 most powerful foods you can add to your diet to help support your heart's plumbing system, naturally and safely. It's the next piece of the puzzle. Click on the video on your screen to watch it now.